mynews.studio.
Mosquitoes are still with us, but this year, malaria deaths have dropped by 1 million. Can science finally get ahead of one of humanity's oldest threats?
Right, and today's date is 2025-12-14. The new World Malaria Report from the WHO marks a milestone: 170 million malaria cases prevented and 1 million lives saved just in 2024. That's not just a statistic. It signals a real turning point in the fight against malaria, which has been a challenge for centuries.
And this progress isn't happening in isolation. Just this year, Georgia, Suriname, and Timor-Leste were certified malaria-free. That brings the total to 47 countries. But is this just the start of a new era? Or are we nearing the limits of what can be achieved?
Let's unpack what's different now. The rollout of malaria vaccines, specifically RTS, SAS01, and R21 Matrix M, has really changed things, hasn't it? By the end of 2024, 17 African countries had included these in their routine childhood immunizations. That's moving from reactive treatment to active prevention, especially in children.
Yes, it's a major shift. In the past, most efforts focused on treating malaria after infection. With vaccines in play, prevention is now possible. Do you think this is what will finally tip the scales for long-term control?
The evidence suggests so. These vaccines are saving tens of thousands of children's lives each year. And alongside that, there are the new mosquito nets, dual active ingredient nets, that can handle pyrethroid-resistant mosquitoes. In 2023, almost 80% of the 195 million nets distributed in sub-Saharan Africa were these advanced types.
So we're seeing a 1-2 punch: effective vaccines and improved nets. But why have some countries, like Georgia and Suriname, managed to eliminate malaria while others are still struggling?
It's a mix of factors. They used intensified surveillance, quick detection, strong vector control, and cross-border cooperation to interrupt transmission. When cases got low, they didn't ease up. They actually increased efforts to trace every remaining case. But I'm wondering, could this approach be adapted for countries in Africa where malaria is still widespread?
That's where it gets complicated. High-burden regions need more than just copying those methods. It's about adapting, combining local campaigns, vaccines, and these new nets, all backed by real political will. Remember the 11-nation African Declaration earlier this year? That shows growing regional commitment.
But there are still big obstacles. Climate change, ongoing conflicts, and drug resistance could undermine these gains. What steps are being taken to hold on to this progress?
WHO and its partners are scaling up proven solutions, vaccines, and new generation nets. There's a push for better surveillance and stronger primary care systems. Plus, we're seeing new innovations like gene-drive mosquitoes. Still, funding gaps and fragile health systems are real problems.
So, overall, malaria isn't gone, but the progress is real. The interventions work, but only if they reach everyone and if health systems stay resilient. Do you think this approach could serve as a model in other global health challenges?
I think so. When science and international cooperation line up, we can change the course of diseases like malaria. The story isn't finished, but for the first time, global eradication seems possible.
1 million lives saved in 1 year. That's the reason this matters. Thank you for joining us as we explored the details behind the numbers.
The mosquitoes may still be buzzing, but malaria's grip is loosening. Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.